Hemoptysis is coughing of blood. There are many causes that can make someone to cough blood, and these include conditions like acute bronchitis, which is infection of the lower part of the lungs. You have conditions like bronchiectasis, which is the irritation of the lower part of the airways. You can also have cancers affecting the lungs and the bronchioles. This could be primary or secondary. Primary is a cancer that is starting from the lungs, and the secondary cancer is cancer that has started elsewhere and has found its way into the lungs. You can also have foreign body in the airway. This could be due to trauma or due to injuries. You can also have pneumonia as a cause of causing someone to cough blood. You can have infections which could be fungal or could be parasitic, and this can make someone to have blood in the cough. Then you have pulmonary vascular diseases, especially what we call pulmonary thromboembolism. Thromboembolism is a condition whereby there is a defect in the coagulation or the clotting mechanism of the blood, and you have blood clots being lodged into the lungs. This usually starts possibly due to three main conditions, where you have the stasis, where the blood flow is affected. You can also have injuries to blood vessels, and you can also have being hypercoagulable situation due to various causes. Then you have blood vessel diseases, what we call vasculitis, causing blood in the cough, and also we have impaired clotting systems due to various conditions, like patients who have genetic bleeding problem, and you also have patients who can have difficulties with the coagulation problems, and in some liver conditions where the coagulation system is affected. So when patients present to the healthcare system with coughing blood, what are we supposed to do? One is you want to establish what is the duration of coughing blood, the amount of blood that has been coughed. You want to establish what are the other associated symptoms, like difficulty breathing. Do these patients have fever or night sweats? Is there a history of smoking? Because people who have a history of smoking, then they are at higher risk of having cancers. Then you also want to establish what is the immune status of the patient. Do they have a HIV infection? Then you want to establish what is the stability of the patient by checking the vital signs. Is the blood pressure okay? And if the blood pressure is low, then you want to stabilize the patient with IV fluids, sometimes with blood transfusion, and this could be life-saving. You want to establish the lungs, the functioning, and you want to examine the heart. So on the investigations, you want to do a complete blood count, which will help you to establish the level of the HB, the hemoglobin level. You want also to establish what is the level of the platelets, and if the patients have infections. The platelets are important because they're involved in the coagulation mechanism. And then you also want to do a coagulation profile. You do APTT, you do INR. You also want to do a chest X-ray. This will help you rule out conditions like tuberculosis, which are a major cause of coughing blood, especially in our setup. You also want to establish where could be the bleeding be coming from. If the chest X-ray does not show you the exact point or the possible cause of the coughing of blood, then a chest CT scan would be important. Then you also want to do tests for tuberculosis, including sputum smears. You can also do gene expert for tuberculosis. You want to do HIV test, and if you are suspecting that patients could be having a cancer from elsewhere, then a PET scan could be necessary. Then there's bronchoscopy, which is putting a pipe into the airways and checking possible source of the breathing. And if you establish that there could be masses in the lungs, then doing a biopsy would be necessary. On the treatment, the specific management is dependent on what is the cause of the hemoptysis. For the first thing you want to establish is, first of all, the stability of the patient. You have to be sure that the airway is okay, the breathing of the patient is okay, the circulation is okay. So you establish 2 large venous cannulas to hydrate the patient if they have hemodynamic instability. There are some drugs you can give to stop the bleeding, and then the specific management of what is the cause of the bleeding. For patients who have pneumonia causing hemoptysis, then IV antibiotics would be necessary. For those who have cancers, then specific management of the cancers. And for those who may have tuberculosis, then treatment with the medication for tuberculosis would be the specific management for the hemoptysis. So thank you very much for watching.